Hi, welcome back to another episode of Drunken Medicine, where we are drunk on medicine and passionate about whiskey. Hi, I'm Dr. May. I'm a naturopathic physician with 13 years of experience treating endocrine disorders. Mike, tell me about yourself.
So I've been practicing for 13 years, almost 14 now, and treat a lot of chronic stuff. I used to treat a lot more acute injuries, like somebody slips, hurts their back. Now I treat a lot more stuff that is kind of deeper and more chronic, like endocrine disorders, menopause, allergies, migraines, that sort of stuff. So a lot of fun, a lot of complex stuff. So let's
Awesome.
start off with the whiskeys, man. Tell me about what you're drinking.
Yeah, so it's still business hours for me, so I'm drinking tea, but I am really excited about a new whiskey I just bought. It's called Wheatfish. It's made by the same company of another whiskey that I've tried on here before, the Glacier Distilling Company here locally. And I actually got to looking, and this one's won some awards. Right now, it's considered the best whiskey in Montana. And recently, this looks like they've had back-to-back silver medal winner from the American Distilling Institute. So pretty cool. Um, Description wise, it says leads with a nose of honeysuckle and ripe pear from a malted wheat, layered with hints of butterscotch and vanilla, a lighter bodied whiskey distilled in the Scotch tradition.
Nice.
So I did have this on a tasting a few weeks ago. It was really good. You could really taste that sort of butterscotch, which just kind of made it super smooth. So I'm really excited to kind of open it up. But for today, it's just my turmeric tea right now.
Not just turmeric tea is delicious.
Well, it really is. So, Mike, what are you drinking?
So today, usually it seems like I'll go a little bougie, right? With stuff that none of our listeners are
You,
probably ever going to try.
you are very bougie. Yes.
Today I went Tennessee and old school. I went with the Dickel 12, Dickel number 12.
Mm,
Now this
nice.
one
Yeah.
is awesome. If you ever see it at your store, and the reason is it's my favorite Tennessee sour mash.
Hmm.
So everybody talks about Jack Daniels. I really don't like Jack Daniels very much. I mean, it's okay, but the charcoal is
Hmm.
just way too strong. It overpowers everything in that whiskey. Unless you get Gentleman Jack, you get a little bit less of that. Whereas
Yep.
this, always 90 proof,
Mm-hmm.
and it's a lot smoother. And you can get this bottle for 26 bucks. And it's
Nice.
a really nice Tennessee whiskey. Probably my favorite Tennessee whiskey is actually Dickel.
Hmm. Wow.
So
Okay.
yeah, you
Yeah.
get that char that you do with, any bourbon or Tennessee whiskey, but you also get a lot of sweetness, toffee molasses. It's nutty. You got a little bit of that tobacco smell, a
Hmm.
little smoke, but not enough to be overpowering. It's just on the nose mainly.
Hmm.
And it's just smooth. I mean, you can mix it, you can drink it straight, you can drink it neat. There's literally nothing you can't do with it. It's one of those bottles that's great to have in your cabinet. You can give it to a guest and they're going to think you're giving them high end bourbon.
Yeah. Yeah.
Yeah. And it's a $26 Tennessee whiskey. So highly recommend it. It's not 12 year, it's number 12 recipe, but it's still delicious.
Yeah. Yeah. I've had that one before. It is nice. It's a nice, like, kind of bottom shelf whiskey that is pretty smooth. Like, I prefer Gentleman Jack myself, but it's a little bit more pricey, and I like it because it just goes. It's a great sipper. Just
Yeah.
really smooth. But Dickel is good too, man. That's a great choice.
And I
I
actually
like.
like the Gentleman Jack a lot. I was talking mainly about the baseline Jack, where it's like so charcoal. And I'm not
Yeah.
insulting Jack for all of the people here that like Jack. It's just the charcoal is overpowering for me. So
Yeah. Side note on Jack, if you're ever in Tennessee, like especially Southern Tennessee, you have to go check out the Jack Daniel's distillery. It's of all the distilleries I've ever been to, and I've been to a lot around the country. That's one of my favorite. It's
oh
just a
really?
ton of history. It's just a great place. They've done a really great job of just the tastings and the tours and all that kind of stuff. Beautiful, beautiful place too.
That's awesome. I need to get my family to open up a tasting room or museum on making homemade moonshine and how to not go blind.
Yeah, that's that usually is a problem.
My family, well, I shouldn't say this. I know people who used to run shine back in the day, but they don't anymore. But
Yeah, yeah.
But
Wink,
anyways,
wink, wink.
yeah, wink, wink. So on to our topic, man. I'm gonna leave it up to you to kind of talk, like we usually do from the Western perspective about menopause, and then we can kind of get into more of the natural stuff, if that's all right.
Yeah, absolutely. So yeah, menopause. I'm excited to talk about this one because it's one that I see on a daily basis, and this is an area where a lot of women struggle. Just this, we'll kind of lump perimenopause in with it as well because women can start, you know, they can start having symptoms of sort of perimenopause, a decade before they actually hit menopause. So we can see some really significant changes in their hormones, like I said, a decade before they actually hit menopause. So that's a rough time a lot of times in women's lives. They're in their 40s. Now there's changes happening. It's a difficult place to kind of navigate sometimes, especially if you're having a lot of symptoms, changes in your cycles, things like that. So yeah. Anyway, so as far as definition goes, so let's start there. So menopause technically is defined as having 12 months without a menstrual cycle.
Oh,
So
really?
without actually bleeding. So
Hmm.
it's a bit arbitrary in that sense, but that's the definition that we give it is once you've been a year without bleeding, then technically you hit menopause. So that's kind of the moment in time that you're considered menopausal. Everything prior to that is perimenopausal or premenopausal, and I'll kind of differentiate between those two. And then everything after that is postmenopausal. So sometimes the terminology gets a little confusing when we're talking about perimenopause versus postmenopause. So just wanted to clarify that. Premenopause is just the period of time before menopause hits. Now, perimenopause deals with the slight changes in hormones and some symptoms that start to arise prior to menopause, but you're not actually in menopause yet. So, some women may start to experience some vaginal dryness, some hot flashes, or temperature dysregulation, maybe some mood changes, depression, anxiety, or just like the inability to take on stress. So that's kind of something I talk a lot with patients about, and I've noticed is this reduced resiliency to stress,
Hmm.
and that can often be a signal for perimenopause. And then sometimes they can start having some cycle irregularity. So they may skip a cycle. Their cycle may get a little shorter or a little longer. There can be tons and tons of variation here. There's not like a cookie cutter sort of set of symptoms that play out here. Every woman is different. And so don't think because your symptoms might be different than your mother's symptoms or your friend's symptoms going through this period of time that you're just kind of weird and something major is happening. That's usually not the case. Usually it's just your body's different. There's tons of variables that play into this, and that's playing into what's causing your different symptoms. So, this is part of like really getting a good assessment of your hormones during this period of time and seeing what they're doing. That's going to give you the best indication of what to do next.
Hmm. That makes
All right,
sense.
making sense so far?
Yeah, makes good sense. And it's funny because, as usual, there is um, overlap with the Eastern perspective because
Mhm.
menopause itself isn't called menopause from the Eastern perspective, but they actually looked at like men and women from life cycles. And so I think this is really interesting. Hopefully you'll think it's interesting too. But there's a 7-year life cycle for women. And so 42 is, that life cycle from 42 to 49. A lot of the stuff it talks about in the ancient literature is actually perimenopause type things for that 7 years. And then 49 is the official menopausal age. And again, it varies from person to person. They just had it in generalities of like
Mhm.
42 is when the decline starts. And then
Mhm.
49 is for a lot of women when it really like ramps up.
Mhm.
But it's interesting because these life cycles is how they really looked at things in the ancient culture. And the men life cycle is 8 years, which I find interesting, and the women's is 7. So
Wow. Huh.
they say
That
the
is interesting.
optimal age for a woman is 28 years old. So that
Hmm.
life cycle from 28 to 35.
Yeah. Oh, interesting. Okay. You know,
And
that does kind of line up. You know, the average age of menopause is around 51 to 52. But again, there's a lot of deviation there with that number. So I've seen women hit menopause, at 45 or
yeah,
49, or they may last till 55 or 59. Like
yeah.
it can vary quite a bit.
And their range is that 7 year range. So like at some point between 49 and 56 is where they really look at this is where it's
Mm,
probably going to happen.
gotcha. Huh, that makes sense. That's a good observation. So, what I'd like to do is kind of list out a few symptoms that I often see kind of that associate with this perimenopausal or getting very close to menopause state.
Hmm.
And then I'm curious, Mike, if like from an Eastern medicine kind of perspective, if you kind of see the same thing, or as far as Chinese medicine goes,
Yeah.
explains kind of the same thing. So I'll
Mhm.
just kind of list off a few things here. Hot flashes, or we'll call these vasomotor symptoms, just changes in sort of temperature regulation there. Mood swings, like I talked about before. So more depression, anxiety, or just
Mhm.
um, loss in stress resiliency. Vaginal dryness and atrophy. So sometimes sex becomes a little more painful, or less enjoyable because it's just uncomfortable. Headaches, insomnia, or other sort of sleep disruptions. Just the sort of poor sleep quality can often be a sign. Irregular periods, like I stated before, night sweats, loss of sex drive, dry skin and hair, joint pain. This is one that I see quite often too, where women are generally pretty active, and then they start experiencing more kind of joint achiness and sort of a loss in the exercise tolerance as well. So not being able to push themselves as hard.
Interesting.
Brain fog, trouble with their memory, concentrating. Some GI symptoms like bloating, weight gain, sometimes abdominal pain. You might get some facial hair growth. So you start growing hair in places that you don't want it and losing it in other places that you do want it, like your head. And then sometimes urinary symptoms, like some urinary incontinence. So anyway, that's kind of the more popular symptoms that I see. Mike,
Yeah.
what's your take on it?
So first, I'll talk a little bit, if it's okay, about kind of the idea of menopause from a Chinese medicine perspective. So I bet you know what organ is the main organ involved. Let's see if
It's
you're a
the
good student.
kidney.
The kidney. It's a kidney yin
Hey.
deficiency. But something I haven't talked about that I'll talk a little bit about is everybody knows, or not everybody, but if you've been listening, you know that there's main channels in the body for different organs, like energy channels, kidney being one of the big ones we talk about. But there's actually a deeper network called the extraordinary vessels that feed into those. So if those channels are the rivers, then extraordinary vessels are the seas that feed them.
Extraordinary vessels. I like the name.
Yeah.
That's
And
great.
the most powerful one, there's 8 of them. And the most powerful one is the Chiang Mai, which is the sea of blood. And it is the absolute one that is the biggest one that pairs with the kidneys and deals with menstruation
Mm,
and menopause. Basically, like if you ever wondered how they see, okay, all this energy stuff, and then you have fluid, like how does that transform? How does that work together? This is how it does it. Is the Chiang Mai basically transforms the kidney energy into blood, from the sea of blood, and you have normal menstruation. So as you get older, that I won't say dries up, but the energy gets weaker and it can't supply anymore. And when it can't transform it. And if it can't transform it, then you don't have a cycle. So that's
mm,
kind of the Chinese medicine perspective. So
mm,
all that said, a lot of the blood symptoms or lack thereof is actually from that extraordinary vessel, the Chiang Mai. Um,
mhm,
and basically, it's just not feeding it. It doesn't have the energy anymore to do it. And then the kidney yin. So kidney, we talked about. Yin is like the cool water. Like, the yang is energy movement. Yin
mhm.
is calm water. And so
Mm.
when you lose that calming water, what do? You get dryness. That's actually one of the big symptoms is hot flashes because you have nothing to ground you. You don't have that coolness to ground underneath. You
Hmm.
get dryness, you get insomnia. So it's a lot of the same symptoms and the same ideas. It's just a completely different perspective on the why because they just
Yeah,
looked at what they could observe.
right, right. That's really interesting. I love it. I love the descriptions with Chinese medicine. Like because you're right, like they had to base these things on observation, right? So they didn't have any microscopes where they could look at and see like, oh, this person has, some ovarians, like early ovarian failure. Like you could diagnose that back then. So you just
Yep.
had your senses to figure out what was going on. So I love that. That
And
totally
changes in
makes
hair
sense.
are also a big kidney symptom. So, any changes in hair, maybe hair where you don't want it, you're losing hair, your hair is turning white, it's getting brittle, it's getting dry. Those are all kidney symptoms as well. So it all actually matches up with the Western perspective, just in very different terminology.
Yeah. Okay. Very cool. So some of you may be wondering out there, like, what exactly is menopause? Like, what happens? What triggers it? Um, and this is just where, basically women, your ovaries start to fail. They just can't keep up. They don't produce, hormones like they used to. Just the same way that men, our testicles just kind of start to fail over time and just don't produce enough testosterone because those are hormones meant to procreate, right? And as we get older, it's just our DNA is changing. It's being damaged just from living longer periods of time, oxidative stress, all that sort of thing. And so generally, we tend to have more problems as we get older and trying to have babies. So if women try to have a baby in their 40s, that's considered a geriatric pregnancy. So it's
Hmm.
it's at risk, and they're at risk for more genetic anomalies, like chromosomal anomalies, like Down syndrome, to kind of list one thing there. But so it's like that's the aging process has an effect on those organ systems, and over time they're starting to fail. Now some women fail really like slowly, and some just kind of drop off a cliff. And again,
Hmm.
this kind of leads to some of that variation. Um, I'll tell you though, if you really want to try to predict when you're going to go through menopause, like pay close attention to when your mom did, or if you have older sisters, or if your mother had sisters as well. Like talking with them and seeing like what their experiences were, it's probably going to be pretty close to that, just because we do
Interesting.
know there are some genetic issues there that can be passed down. Granted, a lot of it's still lifestyle related, so the better you take care of yourself, the better you're going to transition into menopause without a ton of issues. But yeah, that's a good place to start.
That was actually going to be one of my biggest questions is if, because you were talking about environmental stresses, which we talk about every single week, I think, at some point, the stress and environment. But if
Yeah.
that has a big effect on menopause, as well as just cultural stresses, maybe.
Hmm. Yeah, and this is where I see a lot of women in their 30s, like especially upper 30s, where they think they're in perimenopause already because they've already started to have some of these symptoms. And oftentimes it's just because life is very stressful. And you think it makes sense as far as like human evolution goes, in that when our bodies are stressed, it's not a great time to have babies. So, we produce stress hormones, which are diametrically opposed to a lot of our sex hormones. So it's like, testosterone and estrogen, can't sit in the same space at high levels with cortisol and adrenaline, which are stress hormones. So if you're pumping out a bunch of cortisol and adrenaline, you're not going to be making a lot of testosterone and estrogen, and
That makes
progesterone
sense.
and things like that. Yeah, so it makes sense. Like if your body thinks, well, we just need to survive until tomorrow, it's not thinking about having babies. And so oftentimes that's where I'll start if we're seeing like women who are really younger, as far as the perimenopausal stage goes than we would expect. Stress is a great place to start.
Now, is this something you see a gap in with primary care sometimes where there just isn't enough attention because maybe their age isn't right from a doctor's perspective or whatever? I could see that being an issue.
Yeah, there's a big gap here. Oftentimes, Conventionally, it's just like, well, there's birth control if you're having cycle issues. That's kind of the first kind of go-to conventionally, and then it's just like, well, do your best until you hit menopause, and then it'll likely be okay, you know, and just kind of stick it out till then. I don't really like that answer myself. Most of the women I work with don't like that answer either. That's why they come see me. So we're trying to figure out the best way to, if we can, fix it, like improve upon it. Because sometimes, especially if a woman's hitting these symptoms, late 30s, early 40s, I mean, and she still wants to have kids. Like there are still definitely things we can do there to improve her chances, and just not to accept it. Like
Yeah.
don't. I'm reading. Well, I'm rereading Life Force by Tony Robbins right now, and I love that he's so persistent. And when he's talking about his pain, his own like personal pain, like musculoskeletal pain, just not like giving up, not taking. Went to several doctors who said, orthopedics. They were like specialists in their field and everything, and they would say, you just got to live with this, Tony. Like this is your lot in life, for the rest of your life. And he just refused to accept it, and he
Mhm.
figured out solutions. And I often use that example when I'm talking with women, and that just you don't have to accept that answer necessarily, and we can just keep looking for answers and ways to try to mitigate these symptoms and improve your health overall. If nothing else, you're going to get healthier, even if we
Yeah.
don't like improve this and you're able to get have babies. It- the least of it is that we're going to make you healthier, which is great.
Yeah. And I ran into a lot of the same thing. That's why I asked, is because by the time somebody makes their way to me, they've already kind of been through the ringer a lot of times. And they do get that kind of response of just like, yeah, just push through it. Or, yeah, it happens. It's like, I
Mhm.
can't imagine as a guy and I'm having like severe low testosterone like symptoms, which we talked about in another episode. You should go listen to it if you're curious. But so if somebody just told me like, just push through, man, like you're old, it happens, just push through. Like I would
Yep.
be really upset. Like, how about no?
Yep.
How about we
Yeah.
do something?
Yeah. And oftentimes, that advice is given without any assessment. So that's what baffles me is like, hey, let's actually check hormones and look at some things, look at some biomarkers to see like what's going on here. If we can actually account for some sort of metabolic reason why you're experiencing these symptoms.
Mhm.
If we can, yeah, there's likely something we could do about it.
Yeah, and that's somewhere where I think both you and I excel is that it's very proactive. It's not just waiting for something terrible to happen, which I'm not insulting Western medicine, by the way, a lot of Western medicine, because it's like,
Yeah,
if I need a surgeon or if I have a heart attack, I want emergency care, period.
absolutely. Yep.
But there's also a lot of things you can do a decade before major issues come up. And I think
Hmm.
that's where we can excel is like the stuff that doesn't get addressed until it's too late or it's really, really far down the road.
Yep.
And
Yeah.
this is
I
one
mean,
of those
that's
things that's like address it soon, address it right when you notice problems.
right. And that's part of I think some of the issue with conventional medicine at this point in time is, if we can't give it a name, if we can't um, really put it in a box and call it a disease or a disorder, then we tend to kind of push it aside, right? And oftentimes when women are in this sort of limbo type state, this perimenopausal state, they kind of fall in that category. They're not menopausal yet. They don't have any of these other issues that we can call a disease or a disorder or a syndrome. Um, so we just say, well, do the best you can, and it'll likely get better when you hit menopause. And it's like, oh,
Yeah.
that's not a great answer, but that's oftentimes what our answer is because we don't have a nice little box and a treatment strategy
Yeah.
for that. And as far as conventional medicine goes, um,
And I think that's where we all need to work together. I mean, I've seen some doctors in the past, medical doctors in the past, who would be like, don't go to acupuncture. Like they won't do anything for this problem, and then they'll tell you, don't go to acupuncture, don't go to naturopathic
mhm,
medicine. They could make it worse. But then there's like no communication. I think on all sides there has to be communication because there's tons of good
mhm,
research around. menopause and acupuncture. And it's really, really good research, strong research. So I
Yeah.
think that educating and making sure that everyone's working together as part of a team is really important.
Yeah, absolutely. I mean, that's probably one of the biggest issues I have with other providers is don't comment on something that you don't understand or know anything about. Like if it's not your subject of expertise, don't comment it like it is your area of expertise. So you can't say that herbs don't work for this or that if you have no idea what the research is behind those herbs.
Yeah,
So
it's true.
like,
It's true.
just don't comment on it. Just say, I don't know. We have a hard time saying, I don't know, I think, especially
Yeah, doctors
doctors.
and actually not just doctors, acupuncturists are the same. Anybody who has a degree tends to have a hard time saying the words "I don't know." It's
Yeah,
like
yeah,
I have a degree.
yeah. And honestly, like, I had a hard time early on in my career saying, I don't know as well. It was definitely a learned habit. And I learned over time that patients actually they they like that. They like it when you just are honest with them and say, that I don't know about that. I can do some research. I can look it up. We can talk to someone who is an expert in that. But honestly, I don't have an answer for you. And I think they often appreciate that.
Absolutely, I've noticed the same thing. Is like back when I would just try to fake it, which I did a lot. Like, oh yeah, like I've treated this a million times before. Wink, wink. Like
Uh-huh.
instead of just being like, there's certain conditions that I just don't treat as well as others, and I'm really honest. I'm like, yeah, this is one of those conditions. It's 50-50 for me. Like
Hmm.
some people respond really great, some people don't. I have to do some research, and people really appreciate the honesty a lot more than the BS of like, I've been coming to you for 10 visits. What's up? And like, oh yeah, I didn't tell you. Like it's 50-50. Sorry.
Yeah, right. Yep. Yeah, absolutely.
So you were talking a little bit, we talked kind of about how it works and in the medical system. So somebody comes in, let's say with perimenopause, and they've been to their doctor said stick it out. Like, what do you do when they come in your office?
Yeah, so I mean I'm all about biomarkers and data, so I love testing. So this is a great situation where we can do some blood tests of hormones, and then we can do what's called a Dutch test, which is a urine and salivary hormone test. And those tell us two separate things. The blood test can really tell us what your glands are doing. Like, are your ovaries actually producing enough progesterone per se? And then the Dutch tells us, like, what is your body doing with your hormones? Like, how are you metabolizing estrogen? That's really important as we move into menopause, especially if you're going to consider taking hormone replacement, around menopause or leading up to menopause. So getting a good understanding of just what your body's doing with hormones and what the production is, that goes a long way. Now, sometimes it gets tricky because if a woman's in this perimenopausal state and she is having irregular cycles, it gets really tough because there is a certain part of the cycle that we like to test hormones, generally around day 3 and then around day 19 to 21 if they have a normal 28-day cycle. So if your cycle is irregular or you're skipping cycles, that gets kind of tricky. But in that case, we have other tests called cycle mapping tests, which is where women will take samples all throughout their cycle, and we can see what at least their estrogen and progesterone is doing throughout the cycle. And that gives
Hmm.
us some insight too. So again, there are several options here that we can do to gain some insight into what's happening with their body. And once we figure that out, then we can really formulate a strategy in order to like help them achieve their goal, whatever that goal is. Maybe it's to get pregnant again, or maybe it's just to like transition into menopause as easy as possible.
Hmm.
Or
Hmm.
maybe it's like, hey, I know I want to be on hormone replacement once I hit menopause. Let's start to devise a strategy where I can kind of work into that. And so we start doing some lower dosing hormone therapy based on their labs and see how they do. So again, there are a lot of options here. So women out there, don't think that you don't have any options here as far as treatment goes, because just from a functional medicine perspective, there's a ton of stuff we can do. And I'm
Yeah,
sure
it
from a
sounds
Chinese medicine perspective too, there's a lot you can do too.
Yeah, and it sounds really collaborative, which is along the lines of where we come from it too, is like is this collaborative effort of, here's things you can do at home, here's things we can do in the office, working together. So, I'm going to do the usual diagnosis I'm going to do with anyone, tongue pulse, ask a ton of questions about things that people may or may not want to answer. So it's like,
Yeah.
you ask a lot of detailed questions about cycles. Sometimes people can get a little uncomfortable if they've never talked about it.
Yep. Yeah. Oh, yeah. I mean, like I ask women about their cervical mucus and their vaginal atrophy and lubrication and sex and all that kind of stuff. And yeah, it can get a little uncomfortable, but that's good information. We need that.
It is.
Yeah.
It is. And so, basically I go through it. But luckily, from a Chinese medicine perspective, it's almost always like, kidney yin, Chiang Mai, and then some other stuff. If there's stress components, irritability, anger, then that's the
Mhm.
liver qi stagnation, which we've talked about in other episodes. And then I'll do acupuncture. I may or may not do herbs. So if there's
Mhm.
hot flashes, there's some really good herbal formulas that they don't really know why they work, because they used to call Angelica female ginseng Chinese medicine.
Mhm.
They use it a
Mhm.
lot in Chinese medicine. And for a lot of women, it makes a huge difference. And they don't really know why, though, because it doesn't replace the hormones. So, but for some reason, it helps with hot flashes and some of the other, you know,
Mhm.
vascular symptoms. So it gets
Mhm.
prescribed along with the acupuncture.
Mhm.
And people notice a big difference. But I think you're also right, and it depends on what the person's goal is. A lot of it is like,
Yeah.
is it just to get through it with minimal discomfort, or are they trying to get pregnant again, that sort of thing?
Yeah. Yeah. Too. Like, and it was a good point. So a lot of these herbs, especially if women still have some ovarian function. So it's just diminished, right? But there's still function there. So we can do things to try to stimulate their brain, to stimulate their ovaries to produce more hormones. So, for instance, Vitex is an herb that we often use that has that sort of effect on the pituitary gland to help stimulate the ovaries to make more progesterone. And so, if there's still function there, we can stimulate that function to improve their numbers. Also, using like perimenopause is a great time to start adding in phytoestrogens, which are plant
Mhm.
estrogens. These are typically weaker estrogens too, so they don't have the same stimulating effect as the estrogen that you normally produce or the xenoestrogens that you come into contact with in your environment, like plastics and things like that, which are very strong. So it's a really good, safe way, like fermented soy, flaxseed, things like that. Those are good phytoestrogens that you can go ahead and start implementing to just bump up your estrogen levels a little bit. And that's just it. Like if we can just bump up your levels a bit, and that's usually enough to start seeing some improvement in some of these symptoms.
Yeah. Have you ever had Angelica, by the way? It's a really unique taste.
I have. Yep. Yeah.
Yeah, it's a very, very unique taste, and I've noticed there's nothing scientific behind this, but from a Chinese medicine perspective, it makes sense. It's like people who need it tend to really like the flavor a lot more than people who don't. I know it's hippy dippy, but
Hmm.
it's true.
Yeah. Interesting. Yeah. Huh.
But anyways, yeah, so we'll do that. Depending on what they're coming in for, there's acupuncture points to just help with mitigating symptoms. Hot flash, night sweats, sleep problems, that sort of stuff. And then there's whole
Hmm.
protocols if you want to work on fertility. And we'll talk a whole nother episode about that. But Chinese medicine is very, very good for fertility, either with or without IVF. So, in conjunction with IVF, and all the studies have shown it increases by double or more your chances of the IVF taking, which when you're spending
Wow.
$15,000, you want to double
Hmm.
your chances.
Absolutely.
Um, and it's a very specific protocol with very specific points, but
Yeah.
it's really helpful. But even if somebody's not doing that and they're in their late 30s, early 40s, there's still a lot that can be done.
Yeah. Yeah. That's a great. We should do an episode on infertility.
Yeah.
I think that would be great to kind of dive into because in the sort of longevity, anti-aging space right now too of research, of trying to slow down the aging process. A lot of the tools that we're using for that, we can use for infertility to improve the health of eggs, the follicles. and sperm as well. So we reduce sort of the oxidative stress that happens to those cells, and it improves someone's like fertility rate. So anyway, that would be a great topic, I think, to jump into at a later
Absolutely.
date.
I would love to. That's something I treat a lot in Oregon is helping people with fertility stuff. Had a really good success rate. It's wild how it works. It's wild.
Mhm. Yeah, yeah. One thing I did want to just kind of point on real quick is talking about hormone replacement therapy. Like when you start to get into perimenopause, so let's say that you are a good candidate to start some hormone replacement, or you're hitting menopause and you already know like, all right, I know the benefits and the risk here. I am really on board for the benefits. I want to do hormone replacement. There's a lot of misconceptions about hormone replacement, especially in women, and that they think that, and a lot of providers, especially primary care providers, still believe this as well, that hormone therapy is going to cause cancer, and
Hmm.
that is not the case. This has still just been perpetuated from a study done a couple of decades ago called the Women's Health Initiative, and they had to stop the study because women were getting breast cancer at a higher rate. And the reason for it, though, is they were using these very strong synthetic hormones. So they were using conjugated equine estrogen, which is basically pregnant horse urine, okay, as the source of estrogen. And then these synthetic progesterones called progestins. And so it's just like the xenoestrogens we were talking about before. When they hit that receptor for like estrogen, they stimulate it really heavily versus like a phytoestrogen or a plant estrogen, which doesn't stimulate it near as strongly.
Yeah.
And so it's just like it's ramping the signal up big time when you have a strong estrogen doing that. So obviously you're going to see a stronger effect from it. And we've learned a lot since that study too, on like more studies on bioidenticals, being able to analyze that study a little bit more to kind of see, what they did wrong, and uh, devising better studies to look at hormone replacement. And we're starting to see those studies really come out. Like there's some 2021 studies just recently. These were systematic reviews. So they were reviews like meta-analysis of other studies too, and they're seeing like things like 11 to 33% reduced risk of dementia
Hmm.
in women
Wow.
on hormone replacement versus those who weren't, or metabolic changes like a decreased fasting insulin, so less insulin resistance, and so which is type 2 diabetes, and a decreased LDL, which is sort of the bad
Wow.
cholesterol. So we're seeing, and these are in both perimenopausal and postmenopausal women. So we could see some pretty significant metabolic changes in women. And any woman who's gone through menopause knows there's some big time metabolic changes that happen. Most
Yeah.
of the time they're gaining weight. They just don't feel as good. Their exercise tolerance goes down. Their stress resiliency goes down. They have a higher risk for cardiovascular disease at that point, as well as osteoporosis and dementia, and a number of other things too, because
Yeah.
those hormones were protective for those things. That's why, when we're in our 20s and our hormones are at their peak, we're really resilient, right? We can get away with pulling all nighters and really just destroying our bodies and still bouncing
It's
back
true.
and functioning normally, right? But as we lose those hormones, we lose that resiliency too. And then we start seeing all these problems start to pop up.
That's a really good point. I did a lot of stupid things in my 20s and bounced back pretty well.
Yeah.
Um, but one thing that you said that I really like is, just talking about all this, other than just focusing on it. Like you really need to focus on the problems. If something comes up, focusing on it, not strongly, you know, not doing too strong. I like your plant-based ideas too,
Mm,
as far as estrogen. It's very similar to Chinese medicine. There's a lot of fermented soy and other stuff that they use in dietary recommendations that can help a
mm,
lot, that are really, really gentle, that aren't going to push you over the edge. So I think
mm,
all that's really good. And really, making sure you kind of are getting help and building that resiliency and keeping the resiliency, because a lot of it also you can lose, because if you lose your mental resiliency, then your physical resiliency is not going to really matter all that much, because you aren't even going to have the will to do what it takes to move
Yeah.
forward.
Right. Yeah.
It's it's like
Absolutely.
if you tell somebody to go to the gym and their body could handle going to the gym. It hurt, but it could handle it, but their mind can't. Then at no point are they going to push themselves to go to the gym. They've already like given up, and it doesn't even matter what their body can handle. So I think also having that mental resiliency of like, I'm going to do something about this. I'm going to take care of myself, even though it's going to be hard.
Research articles just to kind of see if there's anything new out there in the last year or two that I hadn't seen. And I found this 2023 study. It was a small study. This was only 84 women, but it found that these women who were on a plant-based and an isoflavone-rich diet, which the isoflavones are going to be in those phytoestrogen products, so like the fermented soy, flaxseed, things like that. They found a decrease of 88% in their moderate to severe hot flashes.
Wow.
88%. Yeah,
That's
just
significant.
by shifting to a plant-based diet with high levels of isoflavones.
That's
That's
awesome.
that's pretty significant. Yeah,
Yeah.
absolutely.
And something else you mentioned, I totally lost it, but I got it back. Research. When you look at research, make sure you're looking at more than one study. If you're looking at one
Mm,
study from 25 years ago and you don't know about research, then you may not know that the design was terrible or the sample was terrible. You don't know where they got their sample from. If you're taking them all
mm,
from the same part of the country or the same part of a certain state, like my background's in research for my undergrad. That's why I know about all this. But it's really,
mm,
really important that a lot of that stuff you wouldn't know just reading a study. So you'll look at one
right.
study and be like, oh, well, obviously acupuncture didn't work for this. Look at this study.
Yeah.
And, keep up to date, look for really good research, look for meta-analysis like Dr. May was talking about, different things to make sure you get a whole picture, because looking at one particular study, especially if you don't know the methods, is not going to be
Mhm.
enough to really know what's going on.
Yeah, that's a great point, Mike. We see this all the time in the medical field of, someone citing a research article about this to prove their point. Most of the time
Yeah.
it's someone who has a bias and and they go looking into the research to, validate that bias, right? So they think that hormones are bad, for women. So they start looking for research studies that validate that hormones are bad for women. And they're not looking for actually the truth. It's just to validate their biases, right?
Yep.
And so yeah, you're right. You have to go out there and you have to look at the complete picture of all the studies that were done and then get a better sense of what is this information telling us, because nothing is going to be absolute, right? Especially when it comes to medicine, there are few things in medicine that we know are absolute. Usually
Mm.
they're on a pretty big spectrum, and that spectrum, can be dependent upon, a lot of different variables. So it's not always cut and dry. It's not really simple to come and sort of come up with answers a lot of times because
Yep.
there are so many variables to account for. So we have to keep that in mind when looking at research. And you're right, learning the biases too of the people who are doing the research as well. Are they trying to prove a point, with this research study, or disprove a point? Like we have to consider all of that.
Yeah, even cultural biases. Like if there's certain cultural biases and you're looking at a research study coming out of a certain country, then they may not look at menopause the same way or even look at women the same way. And so then you
Mm-hmm.
have this whole cultural aspect that gets lost in translation, and you're just looking at raw data that doesn't look into those biases. So I mean, it's absolutely right. I know it sounds nitpicky, but it's actually not, because it's a big problem when somebody says I did my research. When I hear that, like from
Yep.
anyone, I'm not angry about it. It's just like a
Yeah.
lot of times that's reading one study, or I watched one YouTube page from some random dude from
Yep.
England who said that this is what menopause is about.
Right, right. Or studies show this or that.
It's
So
true. Studies.
that's the one that really irritates me. Like, what studies? Show me. Tell me exactly what you're
What's your
you're talking about.
citation?
Yeah,
What's your
exactly.
citation?
Yeah,
No,
drives
but
me
but I think
crazy.
it's a good point. I know, like I said, hopefully it won't sound nitpicky to our listeners, but I really do
Yeah.
think it's important because otherwise it can put your mind on a road that you might believe something's true that's not.
Right.
So keep your mind open, ask multiple sources, read multiple sources, talk to doctors and professionals you trust, and then come to an informed opinion. And whatever that is, that's fine, but really do your
Mhm.
research, like actually do your research.
Yeah, absolutely. That's a great point too. Like, don't always put sort of all your eggs in one basket, right? So if you have a primary care, which is great, if they tell you something that you just intuitively just you know that may not be totally right, or there may be more to it, right? Get a second opinion. There's nothing wrong with that. Get a third or fourth opinion. Like,
Yep.
talk to as many different providers and get as many different perspectives as you can, um, before you make a decision, because that's the way to make an informed decision, is to have all the
Yep.
information.
Absolutely. Or as much as you can. Yeah.
Right, right.
I had one person years ago who was dealing with a neurological condition. I'm not going to name it because it could narrow things down. I'm going to keep it general. But neurological condition, and their doctor, the first thing they said is like, "Oh, I'm going to acupuncture. It helps a lot." And their doctor, who knows nothing about acupuncture, said it could make it worse. And
Mm,
I'm like, how is it going to make this? You just don't know. Like it's one of
yeah,
those things where they just said, I don't know enough about this, but instead it's like it could make it worse. You should stop seeing them. And they still
yeah.
came and saw me, but it really tainted some of that relationship for them. And so just be careful. Seek out
Mm.
multiple sources. Even well-intentioned doctors mess up. I've messed up before, and I've had to say sorry to people. I'm sure Dr. May's messed up. We all mess up.
Uh, One or two times, yeah.
In 13 years, one or two times. You're
Yeah,
a genius.
I wish. I wish I could say
You
that,
are
but
actually
yes.
brilliant. You are a brilliant doctor. All joking aside.
Whatever. But yeah, no, it's, yeah, absolutely. You, as a practitioner, you have to be humble, and just know that, and patients just need to know too. Like, early on, you try to fake it till you make it, right? So you try to provide that fake confidence that you know a lot of stuff, right? And you can treat a lot of stuff, but you have no clue what you're doing. and
Yep, it's true.
and as you practice longer, you realize there's just so much more benefit to realizing what little you do know, and that
Yep.
helps to feed that hunger of trying to learn more, trying to understand certain subjects better,
Hmm.
and improving your knowledge base on those. If you're really confident that you understand a subject, it's likely you don't understand that subject,
It's
especially
true.
if it comes to medicine and healthcare and stuff like that, because these are pretty complex issues.
Yep. Yeah. One of my mentors in the acupuncture world has a saying. It's take no credit, accept no blame, because it's
Ah,
like you're going to do the best you can, and the
yeah.
body is going to respond or it won't. And if it doesn't,
Mm,
like you can't take credit when it does, and then like
mm,
not accept blame when it doesn't. So it's
right.
like you're
Yeah.
doing your best, and the body will respond hopefully. And if it doesn't, there might be something else going on.
Mm.
So
Yeah, absolutely. One last thing I want to throw in there before we end the show is, there's a strategy that I picked up years ago from some other functional medicine doctors that I love. I love the acronym here too. But this is just, think of this as far as like a treatment strategy goes for perimenopause to menopause, is remember PTSD, which is is fun because some women think they have a little PTSD after going through this experience. But the P stands for production. So we want to see what your hormone production is, right? The next one is transport. So, like, what are you doing with these hormones? How are you transporting them? So some of this has to do with enzymes and things like that too. The next is sensitivity. So some women are very, very sensitive to certain hormones, and they'll get serious side effects when they take these hormones, and some aren't. And so learning what that sensitivity is, and even if you like, it can explain it through estrogen metabolism, things like that, even better. And then the last thing is detoxification of hormones. This is where I found, like, is the trickiest part. This is where I think most women have side effects. Is they're poor metabolizers of hormones, and this is where this is the woman that comes in and says, "I've had irregular cycles my whole life. I've had PMS. I've had heavy bleeding, since in my teens and 20s, and so they put me on birth control really early." And that's the kind of woman. Like it's likely her production's fine, but she's not detoxing and metabolizing her hormones very well. So
Yeah,
anyway, that's a little acronym I use to just make sure I'm like walking through, like, how am I treating this person? Am I covering all my bases?
I like that. And that's easy to remember. And what a good,
Yeah.
why are all the shows good? I say this every time, but like, what a good show. Went down avenues I didn't
Yeah.
expect. And,
Right.
you know, you guys are like, we don't know where this is going to go. We don't either. It's great.
Absolutely. Like I said, we we don't do a lot of prep for this, so it's just like jump on here and hey, let's talk.
Yeah,
Let's just
it's
talk
a lot of
about our
fun.
experiences and what we know. So anyway, yeah, another great show, Mike.
Hey, thank you so much. And, you know, again, if y'all have questions, don't hesitate to reach out. Here in a few weeks, we're going to be doing some live shows together, which is going to be amazing.
Yeah,
So get ready. It's going to be a blast.
absolutely. That'll be cool to have us in the same place again.
It will.
Yeah,
It's been too long.
absolutely. All right, buddy. Anything else you want to add before we sign off?
Nope. I think it was an awesome show. And thank you all for tuning in. We appreciate it.
Absolutely. Until next week, we'll see you then. Take care. Be healthy.